Hi everyone, welcome back to our channel. Today we will discuss about the most important NORCET mains scenario based questions. Let's start. First question. A patient develops sudden chest pain and shortness of breath after insertion of a central venous catheter. The nurse auscultates absent breath sound on the right side. What should the nurse suspect? Option A, pulmonary embolism. Option B, pneumothorax. Option C, myocardial infarction. Option D, hemothorax. The answer is option B, pneumothorax, because insertion of central line may puncture the pleura, so it can cause the absent breath sound. So it can cause the pneumothorax. So the answer is option B. Next. During the CPR, the nurse notices the defibrillator is ready for shock delivery. What rhythm is shockable? Option A, asystole. Option B, pulseless electrical activity. Option C, ventricular fibrillation. Option D, sinus bradycardia. The answer is option C, ventricular fibrillation. Only in the ventricular fibrillation and pulseless VT are the shockable rhythm. So the answer is option B. Next. A patient with cirrhosis presents with hematemesis and low BP. What is the most likely cause? Option A, gastritis. Option B, esophageal varices rupture. Option C, peptic ulcer. Option D, hemorrhoids. The answer is option B, esophageal varices puncture, because cirrhosis can cause the portal hypertension, and portal hypertension can cause the varices bleed. So it can be occurs esophageal varices rupture. So the answer is option B. Next. A 5-year-old child present with barking cough, stridor and hoarseness. Which condition is most likely? Option A, epiglottitis. Option B, cough, laryngotracheobronchitis. Option C, foreign body aspiration. Option D, asthma. The answer is option B, cough, because barking cough plus stridor and the hoarseness are the main sign of the cough. Next. A nurse is caring for a patient with increased intracranial pressure. Which intervention should be avoided? Option A, elevating head 30 degree. Option B, suctioning frequently. Option C, maintaining neutral head alignment. Option D, preventing standing during the bowel movement. The answer is option B, suction frequently, because if you are suctioning frequently, the ICP will be increased. Should be done only when necessary, but if you are doing suction frequently, it will occur the increased ICP. So the answer is option B. Next. A patient is warfarin therapy. Which lab value must be monitored? Option A, APTT. Option B, INR. Option C, bleeding time. Option D, platelet count. The answer is option B, INR. For the warfarin, effect is monitored by the PT-INR. PT-INR. So the answer is option B. Next, a patient with acute pancreatitis is admitted. Which nursing intervention is most appropriate? Option A, give high fat diet. Option B, encourage ambulation. Option C, keep the patient NPO and start NG suctioning. Option D, administer oral fluids. Giving high fat diet, no. If you are giving high fat diet, pancreatitis can be more worst. So we are not giving the high fat diet. Encourage ambulation, no. The answer is option C. Keep the patient NPO and start NG suctioning. Because rest pancreas, NPO plus NG suctioning. And administer oral fluids, no. Don't administer any oral fluids. Keep the patient NPO and start the NG suctioning, nasogastric suctioning. Next, during post-operative care, a patient develops sudden abdominal distension, absent bowel sounds and severe pain. What complication should the nurse suspect? Option A, paralytic ileus. Option B, peritonitis. Option C, gastritis. Option D, hernia. The answer is option A. Post-operative bowel paralysis can distance and absent the bowel sounds. So the answer will be option A, paralytis. Option A, paralytic ileus. Next, a patient receiving chemotherapy reports tingling, numbness and burning sensation in hands and feet. This is due to option A, cardiotoxicity. Option B, peripheral neuropathy. Option C, nephrotoxicity. Option D, hepatotoxicity. The answer is option B, peripheral neuropathy, because this is a common side effect of the vincristine, cisplatin and taxanes, vincristine and cisplatin. Next, a nurse is caring for a burn patient who develops myoglobinuria, dark brown urine. Which complication should be suspected? Option A, sepsis. Option B, acute kidney injury. Option C, shock. Option D, hyperkalemia. The answer is option B, acute kidney injury, because myoglobin released can occur in the nephrotoxicity, like myoglobin released, it causes the nephrotoxicity. Nephrotoxicity can occur the AKI, acute kidney infection risks. So the answer is option B, acute kidney injury. Next, a pregnant woman develops seizure at 34 weeks of gestation. What is the most important immediate intervention? Option A, start oxytocin infusion. Option B, administer magnesium sulfate. Option C, prepare for cesarean section. Option D, give diazepam IV. The answer is option B. At first we have to control the seizure. We have to give the first line drug in eclampsia is magnesium sulfate. So the answer is option B. Next, in a patient with COPD has ABG, arterial blood gas, pH 7.32, PaCO2 60, bicarbonate 28, HCO3, what does this indicate? pH means 7.35 to 7.45 is normal. So below this 7.35 below is known as the acidic. So this is an acidosis. Then PaCO2 is normal is 35 to 45 and HCO3 normal is 22 to 27 or 28. So bicarbonate is normal and PaCO2 is abnormal, it is increases. So we can say respiratory acidosis with the partial compensation. We can say other option metabolic alkalosis, no. Option C, respiratory alkalosis, no, it's an acidosis. Metabolic acidosis, no, because it can occur the respiratory acidosis. So the answer is option B, respiratory acidosis with partial compensation. Next, a post-operative patient suddenly develops restlessness, tachycardia and hypotension. Dressing is dry. Which complication should the nurse suspect first? Option A, hypoglycemia. Option B, internal hemorrhage. Option C, pulmonary embolism. Option D, myocardial infarction. The answer is option B, internal hemorrhage, because they already told post-operative patient suddenly developed restlessness, tachycardia and hypotension. Dressing is dry. Dressing is already dry and they asked for the complication. Internal hemorrhage should be there because it is a sign of shock without external bleeding. It's showing the internal bleeding. So the answer is option B. Next, a patient with pericardial effusion, so muffled heart sound, hypotension and jugular vein distension. What are the signs? Heart sound is muffled and hypotension is showing and jugular vein distension. What condition is this? Option A, myocardial infarction. Option B, cardiac tamponade. Option C, heart failure. Option D, pulmonary embolism. The answer is option B, cardiac tamponade. It's known as the backstride. In the backstride, muffled heart sound is showing and JVD, jugular vein distension is showing and also hypotension. So the answer is option B, cardiac tamponade. Next, a 6-month-old infant with congenital heart disease becomes cyanotic during crying. Which nursing intervention helps immediately? Option A, give O2 at high flow. Option B, put infant in knee chest position. Option C, insert the NG tube. Option D, give the IV fluids rapidly. The answer is option B, put infant in the knee chest position, because it is known as the TET spell. TET spell. In the TET spell management, we will give the knee chest improves. Knee chest position improves the venous return and oxygenation. So we will keep the patient or the infant in the knee chest position. So the answer will be option B. Thank you everyone. If you are liking the video, please like, share our video and subscribe our channel. Thank you everyone.